speaker, Dr. Anita Shankar, is a medical anthropologist, and she's based at the Johns Hopkins Bloomberg School of Public Health. Sorry, my screen just died here. Let me bring it back. She has more than 20 years of experience in research and programs focused on women's empowerment, maternal and child health, HIV/AIDS, nutrition, and human resource capacity building. She's lived in and/or worked at program field sites in countries across South Asia, Africa, and South America. And her current research focuses on interventions that empower women through increasing their voice, decision-making, and individual agency. So with that, it's my warm pleasure to welcome a good friend and colleague, Dr. Anita Shankar.
Hi, everybody. It's nice to be here. I'm going to try to share my screen. Let's see how I just want to make sure I do that.
You should have the sharing access.
I should have the sharing access. I just want to make sure I've got this up. I had this ready. Okay. Okay. Apologies. I'm going to try this one more time. Okay. Now. Thanks everyone for your patience as I get this up.
And for those of you who are just joining us, these sessions are recorded, so you will be able to go back and do them at your leisure if there's anything that you've missed.
Can you see it?
Yep.
Okay, great. So today I'm going to talk to you about positive public health, mobilizing personal agency to advance individual and community flourishing. So what's positive public health? Why don't we start with WHO's definition of health? Health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. So based on this definition, it really already encapsulates this idea that we should be moving toward thriving individuals. So that our focus should not just be in preventing, treating, or curing disease, but it really should be something more than that. So what is this something more? So I propose to you that something more is a positive public health. And how is positive public health different than regular public health? On the left, you can see that the disease model that we fully embraced within public health. Interventions are designed to avoid pain, reduce stress, overcome deficiencies, and prevent death. And on the right, we see a focus of positive public health, a flourishing model. And instead of the pathologies, the focus is really on strengths, movement toward well-being. In this model, stress is actually considered to be useful, creative stress for growth. And there's also a desire to build competencies and look at factors that promote life and promote thriving. So why does this shift matter? And it matters because interventions that are designed to address disease are fundamentally different than those that are designed to address flourishing. We need to understand what makes humans more capable, resilient, and adaptive. And certainly COVID-19 has revealed a critical need to understand both biological and psychological resilience. And it's not only COVID-19, right? We are faced with fundamental challenges due to climate change, issues of inequity, inequality in our rapidly changing world. So my work is really focused on understanding this idea of psychological resilience in vulnerable populations globally. And a foundation to that is this idea of personal agency. And since personal agency is really foundational for psychological resilience, it's surprising that very few public health actions are actually designed to include such interventions. So what do I mean by personal agency? So personal agency is the capacity and the willingness to take purposeful action and pursue goals. And this is despite challenges that may arise. Personal agency approaches are interventions that help individuals, families, and communities understand how their thoughts, their beliefs, their values, and emotions can impact their behaviors. These approaches build upon recent breakthroughs in positive psychology, neuroscience, behavioral economics, and systems dynamics. A sea change, oh, whoops, what happened? Oh, wow, really moved fast. Over the last several years, my team has developed personal agency interventions and created the evidence for such types of interventions. And this year, we were actually able to launch the Self-Empowerment and Equity for Change Initiative, or C-Change, in the Department of International Health and the Division of Social Behavioral Interventions. C-Change partners with bilateral and multilateral institutions, as well as local communities, organizations, and groups to integrate personal agency interventions into their programming to accelerate and enhance development outcomes. Our approach has three foundational pillars: evidence, practice, and innovation. It's through rigorous scientific research that we build the evidence for personal agency approaches. We take this knowledge and we apply it to training and support on the ground so we can scale what works. And it's also through a focus on innovation that we can look to deepen our impacts, more effectively engage with technology, and strengthen networks and resources. We've worked with organizations in over 16 countries worldwide, from sub-Saharan Africa to South Asia, including Kenya and India. We've also worked in South America, including Bolivia and Peru, and even in the United Kingdom. With the support from USAID, we're enhancing our footprint in the coming years in Central America and Southeast Asia to another 9 countries, including Costa Rica, Mozambique, and the Philippines. So what are some of the approaches that we use for personal agency intervention? The primary approach that we have been working with is a personal agency intervention that works with groups of individuals. And it's important that we work in groups so that the individual agency can be strengthened by the collective agency of the group. The content is anywhere from 30 to 50 hours and can be deployed over a series of days, either or sequentially over time. We use a lot of adult learning principles and experiential learning techniques and peer support. A primary focus is on identifying our own sources of personal power, understanding our core beliefs, and envisioning our future goals. All of our trainings require local adaptation and customization that are done by local trainers. And they're able to translate this information both, through the different language and different stories to help people acquire the skills for behavior change and create doable actions toward their larger goals. So what are the kind of impacts that we have seen with this enhanced agency? For nearly every area that we've worked in, we have seen improved economic conditions, either through livelihood, savings, or entrepreneurship. But an underlying outcome that we're seeing across the board are that individuals who undergo this activity are more likely to take advantage of available opportunities. We've also seen an improvement in self-efficacy, confidence, improved leadership, interpersonal communications, and less stress. So I'm going to show you a little bit of the program data from India and Kenya that was done to look at this. And this is, these were with pilot data, mostly the before and after assessments. And what we did is we worked with these self-help groups in Kenya with a simple 3 to 4 day workshop that was delivered locally. And after 12 months, we looked at changes in economic conditions, health seeking, et cetera. And we found a nearly 2 to 5-fold increase in either savings, ability to take action for various different health issues, desire to engage their kids, to go to school, and improved relationships. We also did kind of a further adapted training with brothel-based sex workers. And we had to expand that to about eight weeks. But after 12 months, we found a much greater increase in adherence to medication for HIV, diabetes, and tuberculosis, also savings in entrepreneurial activities. But what was very surprising was that after about 12 months, 35% of these women were able to successfully pay off their debt and move on to other activities and businesses. So as a result of this program data that we had done back in 2012, 2013, we were able to do a randomized controlled trial to look to see if this personal agency or empowerment training could actually enhance entrepreneurial capacity. And we were funded by the UN Foundation, actually the Clean Cooking Alliance, to look to see if this type of personal agency training could enhance sale of clean cook stove entrepreneurs, both women and men. And so we did this in both a rural and urban setting. And on the left-hand side, we've got basically a survival curve, with the red line being the empowerment training and the blue, the standard business training. And so what we see here is that if you got just the empowerment training, now this is without any additional business training, you were actually able to stay in the business twice as long as if you only got the standard business training. In addition to the business retention, we also saw an increase in sales over time. And again, the red line is the empowerment group, and the blue line is just the standard business training. And I want you to pay particular attention to kind of the increased, the inflection points over the course of time. And those inflection points represent opportunities that were provided by the local NGO that were able to provide the products at a wholesale price. So what it showed here is that those in the empowerment training were much more likely to take advantage of those opportunities, and therefore ended up being able to sell more. We also found that women were also almost 3 times more likely to sell more than men in this particular case. So kind of given the striking results from the scientific studies, we really built upon these learnings and created a personal agency curriculum for entrepreneurs that we wanted to field test. And this was a cascade training approach. And while we didn't find a tripling in sales, we certainly found very similar results in doubling of retention and improved sales. In this graph here, we're looking at briquette sellers. The blue are those in the controls, and the red are those who got the personal agency training. And briquette selling is really challenging. And at the end of a couple of months, only 10% of those untrained actually stayed in the job, and 52% of those who had gotten the training were able to stay. We also found an enrichment of higher income earners as a result of this program, not with briquette sellers, but of other clean energy programs. Alan, you'll let me know if there's any questions that come up.
Yeah, we're gonna do a quick Q&A session after the 3
Okay, thanks, Alan. All right. Okay. Another study that I worked with colleagues at the School of Medicine and the combined study. This is actually a mobile health intervention that was combined with a personal agency training for outreach workers to increase the uptake of HIV prevention of mother-to-child transmission of HIV. And this was done in Maharashtra in India. And what we found was a personal empowerment helped these outreach workers improve relational skills, cultivate positive attitude, and help women navigate barriers to care. And we recently completed a study in a humanitarian setting with about 1,000 partnered women in Congolese refugee camp in Rwanda. And in this case, we actually ended up doing a much shorter training. It was only about 2 days for the women, but we also trained their male partners for about a day. And despite the kind of the short-term course of that training, we were still able to find that women were more likely to increase their earning capacity, start a new business, or learn a new skill. And in addition, if their male partners were trained, we found an increase in task sharing, such as preparing meals, elder care, fetching water, etc. Moving from those activities, I wanted to talk about just some of the exciting collaborations that we're currently doing. As I had mentioned, but maybe I hadn't mentioned, but gender and equity are really foundational to see change in our activities. So in this particular program, we're working with utility companies to expand women's leadership in predominantly male-dominated industries. So we've kind of moved from this empowerment training in an entrepreneurial way, but this is for with employees. And we're working in Mozambique with EDM and in Malawi with Ijenco. Another very exciting, collaboration is with NASA's Severe program. Now, NASA's Severe program, like the Engendering Utilities, is trying to engage women more actively in understanding GIS, geographic information systems, and being able to apply them locally to better manage planetary health. Sea Change is working with NASA on this program with not just women and youth, but also with indigenous populations so that their voices can be better heard. We're working in Kenya, Peru, and Guyana to empower participation and also increase the diversity of inputs. The most recent collaboration, very exciting collaboration, is with the US Peace Corps. And in this case, we're coming back to the entrepreneurship and helping them support their mission to develop individuals' entrepreneurial potential to implement small scale economic activities. So we will actually be working with a community economic development staff who will be trained and supported through a human-centered design process to adapt the personal agency content for local populations. So that's my lightning talk. It's been a real pleasure to be able to present to you this approach and kind of laying the foundations for catalyzing this positive public health through the Sea Change initiative. And I hope many of you will join us. So please feel free to contact me if you're interested about our activities and so that we can create positive public health together.
It's my great pleasure to introduce our next two speakers. Halima Shariff is an accomplished Tanzanian media specialist and communication specialist with more than 30 years of experience. She's worked for more than 2 decades in smart advocacy and in public policy in sexual and reproductive health. She served as the director of advanced family planning in Tanzania, working with the Johns Hopkins University Center for Communication Programs. She's joined by Beth Fredrick, who's an advocate, who's worked for 3 decades to advance sexual and reproductive health and rights in the US and globally. She's the co-PI of the Multi-Country Advanced Family Planning, AFP Advocacy Initiative, under the Bill and Melinda Gates Institute for Population and Reproductive Health at the Johns Hopkins Bloomberg School of Public Health. She's currently the Deputy Director of the Bill and Melinda Gates Institute on Population and Reproductive Health, and the co-founder of the Center on Public Health Advocacy. So it's my great pleasure to welcome Halima and Beth to follow up on with their lightning talk. So over to you guys.
Thank you very much, and it's a pleasure to be joining you from Dar es Salaam, Tanzania. I hope you're having a great afternoon. So my name is Halima Shariff, as you've been introduced. and my colleague who's going to join me is Beth Fredrick. So Beth and I worked together for over a decade to secure the political and financial support needed to ensure that all women and couples are able to use quality voluntary contraceptive method of their choice.
Keep moving my slides from. As one of the largest and longest running advocacy partnerships within the Johns Hopkins Bloomberg School of Public Health, those of us involved with advanced family planning have learned a few things about how to share power effectively. But first, we want to take you to Dar es Salaam, Tanzania in the year 2010. Sit with me and Halima at the end of a long day planning for how advanced family planning would work in the country. At some point, we realized we hadn't eaten anything all day, so we ordered a fish.
So as we watched the sunset over Oyster Bay, we started discussing some challenges we faced in getting the advanced family planning off the ground. I didn't know Beth, and Beth certainly didn't know me. But what happened next set the stage for everything that characterized our advocacy journey.
Since Halima was the host, I trusted her to place the order, but when the fish finally came, it was extremely small. I was sure that Halima felt the same way, and the proof was when she quietly told me to take the body while she took the head.
I remember that Beth suggested that we share the fish equally. What she didn't know is that no matter how big the fish is, I prefer to eat the head.
And I have never ever seen a person eat every morsel of a fish's head than I did on that day. I think of that fish when I think of everything that came after in terms of our working relationship. From Advanced Family Planning's first day, we built shared power through 7 principles. And I'm just going to focus on a few on this list because we're short on time, and the ones that are most important to some of the conversation you've been having today. The first is that advanced family planning has always been locally driven. Local champions set the agenda. We've also always been collaborative, creating an inclusive process that gains consensus and leverages diverse resources. We've tried to be influential, ensuring that those affected by an issue are the most powerful advocates and spokespeople. And finally, we work on being sustainable, sustaining advocacy over time, building capacity into processes, organizations, and systems.
So you may be thinking to yourself, okay, these principles sound reasonable, but how do they work in practice to support equitable partnership? Well, let us share with you 3 ways in which they have supported shared power within the advocacy, the Advanced Family Planning Project, and how you might build similar principles and practices into your own work. I was a seasoned professional when I took the position with the Center for Communications Programs and Advanced Family Planning. I was grateful to the principles, but I didn't exactly trust that we, on the local level, would be driving the agenda. So from day one, however, we had the freedom to fail or fly. As we began to score a number of advocacy quick wins over the years, we equally had the courage to share our failures from the very beginning of the project. A case that vividly comes to my mind was when our honorable members of parliament, groomed as family planning champions, set to appeal to the Prime Minister to do whatever that was within his powers to increase allocations for family planning. Boom. They were confronted with a hard choice. Should funds be allocated for family planning, or should they be channeled to do final touches to the Jakaya Mrisho Kikwete Heart Institute? Guess what? They all rallied behind investing in the completion of the Heart Institute. So our team in Tanzania documented and shared the advocacy outcome.
We were fortunate that our funders, the Gates, Packard, and Hewlett Foundations, agreed with that to be successful, advocacy needs the built-in flexibility that Halima shared. Yet it only worked because we also collectively established the foundation on which all the advocacy would rest. Our theory of change was that if we could change policy and secure funding related to family planning in a focused, incremental way, we would build momentum. And that if we paired that advocacy with efforts to ensure that policies are implemented and funding is expended as intended, we could have a major impact on health, well-being, and prosperity. No matter if we advocated with ministries of health or finance, with members of parliament, county governors, or corporate leaders, the expectation would be the same. What are the specific benefits that they can expect if they take action? Over time, that foundation also included the creation of a strong family planning network that could act quickly and in good times and bad.
The foundation that Beth just described has another dimension that is critical to equitable partnership. It's what happens when the obstacles are so great and the opposition so strong that as an advocate, you simply hit the wall. Let me give you an example. Tanzania's national budget for family planning was erratic at best. 1 year up, the next year down. We advocates were frustrated that we couldn't unlock our government's resources. Our advanced family planning colleagues in Baltimore suggested that we explore opportunities with subnational governments, given their mandate to set budgets for their annual development plans, hence the power to contribute to family planning needs. Of course, partners, AFP partners in other countries were beginning to see results by focusing on subnational governments. So just as we hit the wall, the advanced family planning family opened a door. We engaged local government authorities to make family planning a permanent item in the budget process, which they did. And even in the response to COVID-19 pandemic, local government authorities have ensured that family planning services are not being compromised.
So now you're probably wondering, what did all of this result in? Advanced family planning over the last decade has worked in a number of countries and currently works in 6: Bangladesh, the Democratic Republic of Congo, Kenya, Nigeria, Tanzania, and Uganda. With non-governmental partners, we've used our smart advocacy approach in many more countries and on a variety of issues beyond family planning. Early on, we saw the need for an opportunity fund to go beyond our focus countries and take advantage of new advocacy openings. We have provided 103 awards in 24 countries, totaling nearly $4.5 million. Partners have engaged in global and regional advocacy, shared information across countries, and strategically convened throughout AFP's history. In 2019, AFP initiated a more formal youth-focused regional approach in the 9 Ouagadougou partnership countries of Francophone West Africa. In addition, advanced family planning continues to focus on a multiplier effect, and we've initiated efforts to mainstream advocacy within international NGOs that represent over 80 countries around the world, with over 17,000 employees who have the potential to apply our advocacy approach and skills to their work. And the overall results, we've mobilized $111 million from domestic government resources for family planning and continuing financial and political support to ensure that all people, no matter where they live, have the right and the means to plan their pregnancies safely and effectively.
Equitable advocacy partnerships have also resulted in a total of 2,328 advocacy wins since 2009, out of which 2,261 are core, meaning they respond to budget, policy, and visibility. And the remaining 67 fall under the category of other, that covers adoption and use of the advocacy approach, as well as sustainability of family planning interventions in geographies that no longer receive direct support from AFP. Budget advocacy wins constitute 60% of the core advocacy wins, followed by 33% on policy and 7% on visibility. Notably, 91% of the core wins were achieved at the subnational level. In AFP's most recent project year, November 2019 to October 2020, 92% of the core wins were at subnational level. 77 of these wins were on budget increase, 77% were on budget wins, 10% were on improved policies, and 13% on visibility for family planning through media advocacy. That in fact continues to play an instrumental role in placing family planning on the radar screen, especially during the current times of COVID-19.
We invite you to join us in prioritizing equitable partnership.
And we encourage you to learn more about the advanced family planning's advocacy approach and apply it to your own interests. We sincerely hope that when we are all able to travel again, you will join us for perfectly fried fish.
Just remember, you have the power to split it equitably. Thank you.
Thank you.
That was masterfully done. I don't think I've ever seen a tag team presentation as beautifully coordinated as the one you both have just pulled off. So very, very nicely done. Thank you, Anita. Thank you, Halima. Thank you, Beth, for some very, very thought-provoking and exciting new directions for the way we work together on the global stage. Let me open up the floor for questions from the audience. You can feel free to click on the raise hand button, and that will put you to the top of my list here, and I'll be happy to give you the microphone. And we have about 10 minutes for questions to any one of our speakers from today. While you're either contemplating your next trip with a delicious fried fish, or how to phrase your question, let me maybe get things kicked off. My first question maybe to Anita about the sea change intervention, and actually two questions. One is whether there is a dose response that you've noticed in terms of the longer people are exposed to the intervention package. Do you see greater benefits, or is that not something you've looked at yet? And the second is about scaling up and the capacity to snowball the intervention. Is it something that, and I hate to use this word in the midst of a pandemic, but that can go viral in terms of an intervention, that individuals can teach others within their community and have this scale up sort of organically?
Yeah, no, both very good questions. So we have looked at kind of the dose response here, but in this case, we're looking at not just the length of time people are engaged in this process, but how we're doing it. So for example, bringing people together for a residential process where they're working together over 5 days has really the strongest effects. Now, the idea is to be able to have that group interaction together, and then subsequently have social structure set up so that there's continual engagement around these ideas. That's why working with self-help groups is really powerful, right? Because you want to support those social structures so that it continues to catalyze growth. But that initial learning is there, the language that people are working together, that kind of helping people overcome specific challenges that they're faced in their life it becomes really key. And because at any point in time, any number of the people in the group are either doing well or they're not doing so well. So being able to continue to support each other over time is important. The way I see this effectively scaling is through these partnerships of individuals who are already in the field, on the ground, working toward development outcomes of any kind and across sectors. We've worked in agriculture, we've worked in energy, we've worked in health, but to enhance their capabilities, not only of being able to train people in their populations around these ideas, to be thinking around more of a how do you amplify your capacity to use your thoughts and your beliefs toward the goals that are important to you, but also organizationally to improve your capability in the organization so you have greater self-responsibility, you have greater meaning for the work that you're doing. We're working on that translation of the fidelity of that implementation. And of course, that sometimes creates some challenges when you're working in that cultural adaptation, because you are addressing or hitting against different social and cultural norms. And this is not just, you know, in low and middle income countries, right? It's here in the United States. And it's sometimes not only for in fact, our greatest successes are for those individuals that have low literacy, who are some of the most vulnerable poor, as opposed to those with a lot of education and knowledge, because this is a real change in the way they think. And they're like, no, we know this. Now, please show us the technological, you know, data, you know, some kind of digital app that will help us gain the successes we want. And we're like, no, we got to talk about our feelings. And they're like, no, I don't think that won't work for us. So that's been actually our biggest struggles. But yes, thank you for those questions.
Thank you, Anita. Anna, you had a question. Please go right ahead.
Yeah, well, it's really so beautiful to me that you've all talked about empowerment and partnerships today as we come off of this earlier panel on decolonizing global health. As an organizer of today's work, we couldn't have planned it better. Halima, I'd really like to thank you for joining us from so far and also so late in your evening. When you talked, you mentioned that when you joined this project, you weren't really convinced that there would be local ownership. And you reflected quite a bit on your partnership and called it an equitable partnership with Beth and with CCP. Could you talk a little bit about what was different to you about this partnership, and what advice you might have to researchers to try to create these partnerships as we move forward?
Thank you very much. I think when I joined Johns Hopkins and CCP and the AFP, I think I was much older, probably much wiser, and have gone through a number of other projects that were funded by bilateral partners. So what was different in this project was that the feeling of freedom to choose and contribute. Like many times when the projects come to our countries, yes, there are some consultations. Yes, they're informed by evidence. But sometimes if organizations are not careful, projects come in very prescriptive. Like they have to attain this without really taking care of what the local situation is and how that situation can change. So with the advanced family planning, I think apart from those 7 principles that really became alive throughout the lifespan of the project, is that there was freedom to think through, to brainstorm, to suggest, to fail, as I said. So I felt the feeling of non-prescriptive trust. I think there was a lot of trust to allow local capacities to grow and bloom and just innovate around advocacy. Right now, when we talk about local CSOs doing advocacy at subnational level, once they have the capacity, they're doing their own advocacy, picking the issues around family planning or any other RH or any other issue and doing it by themselves. So it's like that freedom of not feeling that what happens if I fail? These are resources. When we invest, we need to see successes, yes. But I think with AFP, failures are also part of learning. And in the development world, I don't think we can afford to say that we have to be successful. In our countries, things change, political situations change, policy contexts change, nothing is stable. So like during the beginning of this project, we had favorable FP political support from the top. As we continued from 2015 to 2020, we were going through tough times, but we hung on to that, and AFP just gave us the leverage to find ways, be creative, innovate, and find ways, and pick issues, package them in a situation where it's not culturally sensitive, and let decision makers act on them. So we were not saying just family planning. We were talking about maternal health and how family planning is going to help that. We were packaging family planning within demographic dividend. So it's like the feeling of innovation. I mean, just do it the way is right within your local context. That is very empowering. And that actually helps local capacities to grow. And it leaves some legacy. It leaves that sustainability. It just does not end with the project. I could go on and on because it's a breath of fresh air, I'm telling you. We're coming to an end next year, but I just wish and pray this does not end. Thank you.
Thank you for that. Beth, are there any reflections you'd like to add?
I hope it doesn't end either, but I also hope that it continues to evolve and take on other issues. We've learned a lot about how to do this as Halima's described. And I welcome anybody on this call to contact me or Halima, and we can help you if you want to figure out how to adapt it to your own issue or situation.
Beth, can I say something? The people in Baltimore, there's no judgment, no judgmental. That's not there. So nothing is hanging on our heads. Oof. I wanted to say.
And I think that's a beautiful note to end on. It really to find ways to build trust and to create trust. As you mentioned, Halima, you've been in this field for many years, and I think, you know, especially if you are in a country that has survived many generations of exploitative work or research, it becomes difficult to trust immediately. And I think that's probably one of the uphill roads that all of us have to climb, is to find ways to build trust and faith in good faith in the work that we're doing, and in the fact that there isn't a big specter hanging over the heads of folks who are implementing to succeed at all costs. And I think that's really valuable. We've come to the end of the session, and I want to thank all three of you for sharing your exciting work and your thoughts with us. I will make a shameless plug while we go into our virtual break. I'm sorry I can't email all of you a cup of tea and a biscuit, but Dame Sally Davies will be joining us at 4 p.m. Eastern Time, which is 30 minutes from now. She's the Master of Trinity College in Cambridge University and the former Chief Medical Officer and Chief Medical Advisor for England, in addition to a large number of accolades, joining a host of phenomenal speakers that we've had lined up over the course of today. So thank you all for joining us, and we look forward to seeing you in 28 minutes. And so we will see you shortly. Thanks again. And thanks, Halima. I'm in the same time zone as you, so I feel the pain of the 9:30 p.m. sleepiness. So really appreciate you being here.
Thank you, Alan.
Thank you.
So